We're going to begin with this. It's a dangerous and deadly Ebola outbreak in Central Africa. I know you've heard about this. Secretary of State Marco Rubio says the Trump administration may appoint a single official to lead the U.S. response on this. Critics of the Trump administration say that budget cuts have made it very difficult to react to the outbreak. Rubio, by the way, has rejected that charge. Ramy Inocencio has more on the Ebola response.
U.S. aid operations like these used to help trace and treat past Ebola epidemics in Africa. Now, health workers say they've been left blind after the Trump administration pulled U.S. funding.
I think the U.S. funding cuts certainly contributed to the late understanding of the current situation and is part of the reason why we're so behind in responding now.
CBS News medical correspondent Dr. Celine Gounder worked in West Africa during the Ebola crisis a dozen years ago. She says the funding cuts would have been felt immediately.
Once you don't have money, once the money runs out, you can't be ordering supplies from various different sources. You can't be paying salaries.
The U.S. is now responding with attempts to keep Ebola isolated in Africa and being met with anger in Kenya. The hope is to build a 50-bed quarantine facility here, but only for Americans. Meanwhile, aid groups in the Congo are working with local communities, opening treatment centers like this new 60-bed facility built by the World Health Organization. The first suspected Ebola case was 40 days ago.
Why did it take so long?
This Ebola type is a rare one. The test kit people used was optimized for the Zaire type and not for the Bundibujo type.
That Bundibujo strain still has no vaccine.
Is Ebola still outpacing what's being done?
The virus has circulated. It was really a way ahead. That's why now this is a catch-up.
As the world plays catch-up, health officials emphasize that Ebola does not pose a grave threat to the world.
We will do everything to make Americans safe and the rest of the world safe as well.
And Dr. Ghebreyesus also told me that Americans should not be worried about this outbreak and that the risk assessment for the rest of the world still remains low. That is the takeaway here, Vlad.
All right, Ramy, thank you very much.